It is unforeseen how people are wearing masks to prevent them from catching the newest viral infections such as the coronavirus, but no one wants to take proper precaution into wearing a condom to prevent the transmission of HIV and AIDS. Most, if not everyone in this room is sexually active and at equal chance of catching this virus. This virus is so sneaky that the very person next to you could have it and you not know it. As a health science major and with a passion for disease control and prevention, I have done extensive research on the HIV and AIDS virus to further enhance my knowledge to inform the audience. Today I'll be discussing the what, where, when, and hows of HIV and AIDS. What is HIV and AIDS? HIV is the human immunodeficiency virus. According to the Medline Plus, HIV is a virus that attacks cells that help the body fight infection, making a person more vulnerable to other infections and diseases. This also means that the T cells are being killed off by the virus. This is lowering the effectiveness of the immune system. HIV could also lead to AIDS. This strain of the virus is more deadly as the level of T cells have almost completely depleted. The likeliness of death is more profound with this strain. AIDS is the acquired immunodeficiency syndrome. According to the Medline Plus, AIDS is a chronic, potentially life-threatening condition caused by the human immunodeficient virus, which is HIV. People with this disease, that is accelerated and untimely, and it can happen any day. It can happen from any cold, any flu, or any coronavirus. Without the proper treatment, even after the first sickness flare, there could be complications. Medline also said, by damaging your immune system, HIV interferes with your body's ability to fight infection and disease. This ultimately means there is a higher chance in death when contracting AIDS. Things like the flu could be life-threatening, as said previously. Now we'll talk about the different ways to contract the disease. There are many ways that the disease can be caught and spread. Being not only sexually active and not getting tested at the appropriate time, but even the use of drugs could put the patient at a higher risk for contracting the virus. According to the National Institute of Drug Abuse, young people are at the risk for the infection. Their statistics shows that approximately 9,800 people aged 13 to 24 diagnosed with HIV in 2010, representing 20% of newly diagnosed cases, with the highest rate occurring among those aged 20 to 24. Youth on the streets gravitate more to this behavior as they have more to deal with because they're out on the street and they have their minds are used to being like tampered with, and they're prone to building habits such as drug addictions. And people get to drug addictions by the circumstantial situations. These are common with drug injections. Sharing needles leads to the transmission of HIV and AIDS. Using dirty needles can also contribute. With contracting the HIV and AIDS, it may be hard to do if you have done these things, because it will be easier for you to do if you have done these things because they come in an array of symptoms, and it'll be hard to catch the symptoms because sometimes the symptoms they don't come at all. According to Planned Parenthood, symptoms can include, but not limited to, HIV can destroy the cells in your immune system called CD4 cells, T cells. Without these CD4 cells, your body has a hard time fighting off diseases. This makes you more prone, like I said, more prone to disease. I can't stress that enough for that, because if you have this disease, and you're more prone to catching a lot of more other things. The damage HIV does to your immune system leads to AIDS. Symptoms include, but not limited to, as well, patients are typically tired all the time. They have swollen lymph nodes. They can also possibly have a fever that lasts longer than 10 days. This is more of a dangerous symptom because it leads to them having more problems like breathing and things like that, because their immune system has been breached. So, like I said before, anything could contribute to untimely death. Lastly, I'll be going over the proper protocol to protect yourself from the virus. There's a plethora of ways that you can protect yourself from this virus, such as abstaining from sex, and always getting tested on time. I use condoms and everything that is necessary, because condoms are 99%, but abstinence is 100%. With these few contraceptives, you will always be a slighter chance of contracting these viruses. But understanding what HIV, AIDS, is how you can contract it and when to protect yourself against it and to lower your chances of receiving the virus. It will help you build a better knowledge and a better health. When engaging in sexual activity, it's best to protect yourself while you have the tools rather than to risk your life trying to find protection, because by then it will be too late.